This
Oh,
conference will now be recorded.
there we go.
On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decision for Kaiser Foundation Health Plan of the Northwest Small Group Fourth Quarter Rate Filing. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, Division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is, how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Actuaries also consider the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure the meetings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. Our agenda for this afternoon will be representatives from Kaiser describing their request. Then Division staff will lead a discussion about the Division's review and preliminary decision on the filing. Finally, we will accept public testimony. If you'd like to make a comment on a company's filing, please unmute, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. today, April 12th. The Division will make a final decision about this rate filing shortly after the public comment period ends today on April 12th. Kaiser, please begin by introducing yourself and explaining your request.
Hello, my name is Luke Hampton. I am a senior associate actuary at Kaiser Permanente. We are requesting to change our fourth quarter rates for this small group block of business. This would impact about 15,000 members, a little bit over 15,000 that renew in the fourth quarter. And this request is to change our rate increase to where it would be 1% increase over the previous year, and this is a decrease from our originally filed rates, where we had filed for a rate increase for the fourth quarter of 3.2, so we're willing to lower that to 1%. The minimum rate increase would be a negative 1.5, and the maximum rate increase would be 2.4% with this revised filing. Hello, is anybody else there?
Sorry, Ethan, maybe you're on mute.
Yep, sorry about that. Thank you. Now, Division actuaries will lead a discussion about the Division's review of the filing and preliminary decision.
Thank you, Ethan. My name is Michael Sink, Life and Health Actuary for the Division of Financial Regulation and primary reviewer of this filing.
Hi,
I don't know if anybody else.
I'm the Life and Health Program Manager for the division.
Hi, TK Keene, Administrator for the division. I believe that's
okay. I think that's everybody. I'll go ahead and go through this filing. The division actuaries, when we review these filings, we like to focus on three broad categories of review when we look at filings, and there's additional reviews for quarterly filings. So I'll go through those first. We first like to look at the data sources going into the filing, make sure that they make sense and match the financials for the company. We like to look at the assumptions that they use to get from the base period to the projected period when they are ultimately getting to the rates that they are requesting. And finally, we look at the calculations to get from point A, which is the experience period, to the projected period, point B, and we make sure that those are actuarially sound and correct. So there is an additional review item that we look at when we're talking about a quarterly filing. Most filings that we do will have an effective date of January 1st of the year, and these will be the annual review that these filings are coming in May. This is a fourth quarter filing, so this will only affect members renewing in fourth quarter of 2021. Anybody who is renewing January 1st, 2022 or later, this filing will not apply to you. There will be an additional filing due in approximately a month. So it's something to keep in mind when we're talking about this. We are only talking about those who are renewing October through December of 2021. And only in the small group market. So this is a rate decrease, it's an overall 1% increase, but it is a decrease because we have already approved rates for them to use in fourth quarter. So we are looking at this in terms of what changed from the January filing last year to the fourth quarter filing this year that caused that rate decrease. And the calculation, the breakdown to get to that point on this filing was actually pretty straightforward. The membership that Kaiser reports in their base period experience, which is 2019, was approximately 15,000 members. But by February 2020, they're reporting 30,000 members. So that's significant growth and change. The change in the filing is in their assumption to the risk adjustment payments that they will have to make. And that would make sense if you're growing more membership, that you expect your average risk to go closer to the middle. And that's what they're doing in this filing. They've their membership growth is driving down the risk adjustment assumptions, $14, which when you look at it based on plan mix is only $9. That as a percent of claims is 2.5%. And because claims are only 84% of the total cost, the premiums come down 2.1%. And that is the entire calculation. They didn't change anything else. So this is a very easy review, consistent with the first quarter filing. Anything that I might question, we've already approved on the first quarter. I am noting things that I will continue to look for in first quarter of next year's filing. Methodologies that Kaiser does that are a little different than the market. But again, this is consistent with their prior filing. So at this point, I'm agree with their calculations and their results. The division is approving this filing as filed.
Mike, Kaiser, any additional information or comments you'd like to make at this time?
No, I would just say that we agree with your preliminary decision to approve this filing.
Thank you. Any public comment and any other information before making a final decision on this filing? We will now take public testimony. If there's anyone who would like to make a comment, please unmute and introduce yourself. All right. No one has signed up to testify, so let me remind anyone listening that today, April 12th, is the last day for public comments. Comments can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.